This is All India Radio. We now bring you a special news program on COVID-19. Good evening. I am Tanvi Taneja and with me is R.S. Raghu. The headlines. Group of Ministers reviews COVID-19 situation. Health Minister says use of technology is integral for containment strategy. Home Ministry issues guidelines for movement of Indians stranded outside as well as those stuck in India. India to operate 64 special flights to repatriate over 14,800 stranded Indians from 12 countries. All existing visas suspended till prohibition on international air travel. Government procures pulses and oil seeds worth 2,682 crore rupees, benefiting more than 3,25,000 farmers. And JEE mains to be held from 18th to 23rd of July and NEET examination on 26th of July. Health Minister Dr. Harshvardhan today chaired the 14th High-Level Group of Ministers GOM meeting in New Delhi. The GOM reviewed, monitored and evaluated the evolving situation on COVID-19. A presentation on the ground-level situation as well as the latest statistics with respect to coronavirus was also made during the meeting. The GOM had in-depth deliberation on containment strategy and management aspects of COVID-19 as well as the measures being taken by the centre and various states. The GOM was apprised that as of now, the death rate is around 3.2%, while recovery rate is more than 25%, which may be taken as a positive effect of lockdown in the country, along with cluster management and containment strategies. The GOM was also informed that genome sequencing of strains of the novel coronavirus isolated from patients in different parts of the country has been initiated. The group of ministers highlighted the need for ensuring that stringent measures of quality control were ensured for PPEs, masks, ventilators, etc. It also stressed on random batch sampling for ensuring compliance and adherence to the quality standards laid down. The GOM also expressed satisfaction over the work done by ministries and empowered groups. Dr. Harshvardhan stated that the use of technology is integral for the containment strategy and is helping the states to manage COVID-19 in a more effective manner. The GOM was attended by External Affairs Minister Dr. S. Jaishankar, Civil Aviation Minister Hardeep Singh Puri, Minister of State for Home Nityanand Rai and Minister of State for Health Ashwini Kumar Chaubey. Chief of Defence Staff General Bipin Rawat and Home Secretary Ajay Kumar Bhalla and senior officials were present at the meeting. The number of COVID-19 cases in the country has climbed to 46,433, while the death toll stands at 1,568. Briefing media in New Delhi today, Health Ministry officials said the number of active COVID-19 cases stood at 32,138. As many as 12,726 people have been cured or discharged. He said the recovery rate is 27.41%.
अगर हम पिछले 24 घंटे में देखें तो पाते हैं कि 1020 पेशेंट्स क्योर हो चुके हैं, जिससे हमारी टोटल क्योर लोगों की संख्या बढ़कर अब 12,726 हो गई है, जिसके कारण हमारा टोटल रिकवरी रेट बढ़कर 27.41 हो चुका है. टोटल 32,138 केसेज एक्टिव मेडिकल सुपरविजन में हैं. पिछले 24 घंटे में 3,900 एडिशनल केसेज कंफर्म नोट किए गए हैं, जिसके कारण हमारी कुल कंफर्म केसेज की संख्या अब बढ़कर 46,433 हो चुकी है.
The Health Ministry official said lockdown has yielded very positive results and doubling time has improved from 3.4 days before lockdown to 12 days now. He said at the same time it is important that the momentum is sustained. The official said the number of new cases and deaths reported during the last 24 hours has been the highest so far in any day. He said timely reporting and management of cases is very crucial. He said the government has found gaps in some states and these have been addressed after due persuasion. He said some states had not been reporting COVID-19 cases timely, and after persuading them, they have reported such cases. He said it is the reason for the sudden spurt in the number of cases since yesterday. The official said, as the government has relaxed the lockdown, every citizen should contribute to break the chain of transmission as part of his or her social responsibility by following all precautionary measures. He said the Health Ministry has issued additional guidelines for rational use of PPE by health workers and other personnel in non-COVID-19 hospitals and non-COVID treatment areas in COVID hospitals. He said it is important that each and every contact of positive patients needs to be traced. The Home Ministry official said workplaces must ensure thermal screening and face masks, sanitizers and hand wash in ample quantity. She said work shifts and lunch hours should be such that maximum social distancing is ensured. She added that workplaces and company transport must also ensure distancing. The official said no organization is allowed to gather 5 or more people in one place. Not more than 50 people can be allowed to gather in wedding-related functions, and not more than 20 people are permitted at funerals.
सार्वजनिक स्थानों पर सबको 2 गज की दूरी बनाए रखना जरूरी है। इन स्थानों पर शराब, पान, गुटखा, तंबाकू इत्यादि सेवन करना वर्जित है। दुकानों पर सोशल डिस्टेंसिंग के नियमों का पालन किया जाना अनिवार्य है। दुकान पर एक समय में 5 से अधिक व्यक्ति नहीं हो सकते। किसी भी संगठन या ऑर्गेनाइजेशन को 5 या 5 से अधिक लोगों को एक स्थान पर इकट्ठा करने की अनुमति नहीं है।
In Bihar, the number of patients from coronavirus infection has gone up to 142. The recovery rate of cured patients is 26% in the state. In all, 397 patients are undergoing treatment in various hospitals of the state. Number of positive cases is 535 in 32 districts of the state. There are 74 containment areas in the state. NDRF teams have been deployed in hotspots and containment areas of the state. The state government has announced ex gratia of 10 lakh rupees to the next of the kin or of the deceased sanitization worker. About 13,000 stranded migrant workers and students from Kota, Rajasthan have reached different parts of the state by 10 special trains. Another district of Jharkhand, Koderma, joins the League of Corona-Free District in the state after Dhanbad and Hazaribagh. The single patient detected from Koderma district has been discharged from hospital after recovery. Meanwhile, 7 other COVID-19 patients have been discharged from RIMS hospital in Ranchi after recovery. Kerala government announces detailed guidelines in connection with the scheduled arrival of non-resident Indians to the state from coming Thursday. A report.
Chief Minister Pinarayi Vijayan, after the high-level meeting in Thiruvananthapuram today, informed the state's guidelines on the arrival of Keralites from other countries and states. He said as the primary motto remains to contain the spread of COVID-19, the situation ahead had to be dealt with utmost care and alert. On the arrival of the non-resident citizens in airports and ports in the state, after the initial medical testing, all of them, whether having symptoms or not, will be taken to the state's COVID care centers for a compulsory quarantine of 7 days. After 7 days, the PCR testing will be done, and in case of negative result, they will be sent to strict home quarantine, and in case of turning positive, they will be shifted to hospitals. Mr. Vijayan said that the state is prepared for the arrival of people from outside with over 250,000 isolation beds and other medical facilities. Meanwhile, 3 more positive COVID-19 cases were reported from Kerala today, taking the total number of active cases to 37 in the state. Mayusha for AR News from Thiruvananthapuram.
Uttar Pradesh government has intensified the process of testing the suspected corona patients. Until now, more than 1 lakh tests have been conducted in government and private labs of the state. The recovery rate of COVID in the state is 33%, which is 6% more than the national average. A report.
1,01,630 tests have been conducted so far in the labs. The state has now 1,862 active cases in 60 districts, while 944 patients have totally recovered from COVID-19 infection. The recovery rate is 33%, which is much higher than the national average. Meanwhile, the process of bringing back and sending back the migrant laborers continues in the state, and more than 65,000 migrant workers and students have been sent to their destinations. Around 10 trains from different states have reached in state with migrant workers on board. 5 to 6 trains will reach today, while 9 trains have already moved from different states. Discussions are on for the movement of 6 more trains for the safe arrival of migrant laborers. Sushil Chandra Tiwari, AIR News, Lucknow.
In West Bengal, 7 people died of corona infection in the last 24 hours, taking the death toll to 68 in the state. Giving this information in Kolkata this afternoon, State Home Secretary Alapan Bandyopadhyay said that another 85 people were tested positive of coronavirus during the period. More from our Kolkata correspondent.
A special train carrying around 1,200 migrant laborers has reached to the state from Ajmer Sharif of Rajasthan. Another train from Kerala will also bring such people to state tomorrow. The third phases of lockdown is being maintained in the state with relaxations announced by the central and state governments. Over 516 containment zones are in place to fight against COVID-19 at different districts of the state, of which maximum 318 are in Kolkata. The state government has suspended 64 ration dealers and issued show-cause notices to 359 dealers and imposed penalties against 25 of them for irregularities on supply of food items through public distribution system. Arijit Chakraborty, AIR News, Kolkata.
Home Ministry today issued SOPs for movement of Indian nationals stranded outside the country and also for persons stranded in India who are desirous to travel abroad for urgent reasons. As per the SOPs, the priority will be given for travel from abroad to compelling cases in distress, including migrant workers who have been laid off. People faced with expiry of short-term visas, those with medical emergency, pregnant women and elderly will also be given priority. The cost of travel will be borne by travellers. Before boarding, all travellers will give an undertaking that they will go mandatory institutional quarantine for a minimum period of 14 days on arrival to India. At the time of boarding the flight, all travellers will undergo thermal screening and only asymptomatic travellers will be allowed to board. The passengers will have to register on the Arogya Setu app. During the journey, all passengers will have to follow social distancing and hygiene protocols. On the arrival to India, they will be screened and passengers found to be symptomatic will be immediately taken to medical facility. If they test negative after 14 days, they will be allowed to go home and will undertake self-monitoring of their health for 14 more days as per protocol. The SOPs for persons stranded in India who are desirous to travel abroad for urgent reasons say that they will have to go to thermal screening and only asymptomatic passengers will be allowed to board the flights. They will also have to follow the health protocols. The cost of travel will be borne by travellers. The government will operate 64 flights to repatriate stranded Indians abroad. Addressing a digital press conference in New Delhi today, Civil Aviation Minister Hardeep Singh Puri said the flights will be operated from Thursday till 13th of this month.
Total number of flights that will be operated during the first week to 64. Operation of these 64 flights has become possible only because we have received the full cooperation of the state governments.
The 64 flights include UAE 10 flights, Qatar 2, Saudi Arabia 5, UK 7, Singapore 5, United States 7, Philippines 5, Bangladesh 7, Bahrain 2, Malaysia 7, Kuwait 5 and Oman 2 flights. Out of the total, 15 flights will bring back people to Kerala, followed by 11 flights each to Tamil Nadu and Delhi. 7 flights will be flying back people to Maharashtra and Telangana, whereas 5 flights are slated for Gujarat. Maximum number of flights in the first week of repatriation will bring back citizens from the Gulf countries. Meanwhile, Navy has confirmed that 3 of its ships are on the mission to get back stranded citizens from Maldives and UAE. INS Jalaswa and INS Magar will get back Indians from the Maldives, while INS Shardul has been diverted to Dubai to get back the expatriates from West Asian countries. The government has prepared a detailed roadmap to repatriate over 14,800 stranded Indian citizens from abroad due to novel coronavirus pandemic. Amidst the global pandemic, Government of India will facilitate the return of more than 5,000 distressed Indians from various countries in the Gulf within the first week. More from our Dubai correspondent.
Amidst the global pandemic, Indian missions in the Gulf countries are gearing up for the major evacuation operation, which is scheduled to begin from 7th of May. Embassy and consulate officials in the Gulf countries are involved on a war footing to prepare the first list of the distressed citizens. Priority is being given to workers in distress, elderly people, urgent medical cases, pregnant women, and others stranded in difficult situations. For the Gulf countries, in the next 1 week, 25 flights will be made operational, 10 from UAE, 5 each from Saudi Arabia and Kuwait, and 2 each from Qatar, Oman, and Bahrain. Airlines will follow standard operating procedure, and only those will be allowed to board who are found asymptomatic. Kanchan Prasad, AIR News, Dubai.
Government has suspended all existing visas granted to foreigners except certain categories till the prohibition on international air travel of passengers from and to India is lifted. Earlier, it was suspended till 3rd of this month. The Home Ministry said the right to a multiple entry long-term visa facility for visiting India for any purpose granted to overseas citizen of India OCI card holders will also remain in abeyance. Government has also granted consular services to foreign nationals stranded in India due to travel restrictions in wake of COVID-19 outbreak up to 30 days from the date of lifting of prohibition on international air travel. This is All India Radio bringing you a special program on COVID-19. Group of Ministers reviews COVID-19 situation. Health Minister says use of technology is integral for containment strategy. Home Ministry issues guidelines for movement of Indians stranded outside as well as those stuck in India. India to operate 64 special flights to repatriate over 14,800 stranded Indians from 12 countries. All existing visas suspended till prohibition on international air travel. Government procures pulses and oilseeds worth 2,682 crore rupees benefiting more than 3,25,000 farmers. JEE mains to be held from 18th to 23rd July and NEET examination on 26th of July. A reminder of the headlines before we move on. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
The government today said that pulses and oilseeds worth 2,682 crore rupees have been procured, benefiting more than 3,25,000 farmers. The Agriculture Ministry said a quantity of over 2,61,000 tons of pulses and 3,17,000 of oilseeds have been procured under the Rabi season 2020-21 till 2nd of this month. Besides, in Rabi marketing season, a total of over 1 crore 87 lakh tons of wheat arrived in the Food Corporation of India, out of which over 1 crore 81 lakh tons has been purchased. The ministry said the sowing area coverage of the rice summer crop has increased to over 34 lakh hectares as compared to over 25 lakh hectares during the corresponding period last year. The coverage area of pulses has increased to over 8 lakh hectare coverage as compared to over 5 lakh hectares during the corresponding period of last year. The ministry said it is taking several measures to facilitate farming activities at the field level during the lockdown period in the wake of COVID-19 pandemic. Under the Pradhan Mantri Kisan Samman Nidhi scheme, more than 9 crore farmer families have been benefited and an amount of over 18,000 crore rupees has been released so far during the lockdown period. Rajia Khatun of Nevada, Bihar has received benefits under the PM Jan Dhan Yojana. She thanked the government for the initiative, saying it has provided the much needed support.
मैं इस्लाम नगर में रहती हूँ। मैं बैंक से आई थी पैसा निकालने जनधन कंपनी से और मुझे मोदी सरकार तरफ से आया पैसा ही है कंपनी से, तो कोई तकलीफ नहीं है, आराम से निकाल कर लेके चली गई इलाहाबाद बैंक से।
The hour of crisis reveals the best of all. Likewise, the Inner Wheel Club of Balia has come forward with a helping hand. The club has helped not just the needy, but newspaper hawkers, home guards and women amongst others. The club has so far distributed more than 1,500 cotton face masks and is still in the process of making more of such masks. The club has so far distributed more than 200 kgs of rice and wheat. The Annapurna Seva is another unique initiative of the club in collaboration with the district administration. Under the Annapurna Seva, the members have come forward voluntarily to cook food for police personnel, NCC cadets and others as and when required. Speaking to AIR News, President of Inner Wheel Club Balia, Anita Sinha, further elaborated on the initiatives of the club.
हम लोगों ने एक अन्नपूर्णा सेवा ग्रुप फॉर्म किया है जिसमें हम अबाउट 26 लेडीज का ये ग्रुप है और हम लोग खाना प्रोवाइड करते हैं। जब इमरजेंसी सिचुएशन आता है एडमिनिस्ट्रेशन सबको खाना प्रोवाइड कर रही है, जो भी बाहर से लोग आ रहे हैं या जो दिन रात काम करते हैं उनके लिए। बट कभी ऐसा होता है कि कुछ लोगों का खाना कम पड़ जाता है तो हमें इन्फॉर्म किया जाता है एंड विद इन 45 मिनट्स हम घर में खाना बना के उन लोगों को देते हैं।
Talking to AIR News, DM Balia, Shri Hari Pratap Sahi explained that though Balia is in green zone, the administration is taking all precautions to keep the district COVID-free. He said quarantine facility for 20,000 migrants have been made in the district. He appreciated the contribution made by the Inner Wheel Club and other organizations to help the needy.
बलिया जनपद में जो कोविड-19 के अंतर्गत बहुत सारी जो निसहाय निराश्रित लोग हैं उनके सहयोग के लिए बहुत सारी संस्थाएं आगे बढ़ के आई हैं। मास्क जो सबसे बड़ी जरूरत है आजकल के समय, और बहुत सारे ऐसे लोग हैं जो मास्क नहीं खरीद सकते, ऐसे गरीब लोगों के लिए भी मास्क का एक बीड़ा उठाया है जिला प्रशासन ने। अभी हम एनसीसी के लड़कों को हमने आह्वान किया है, जो बैंक पर जो बड़ी भारी संख्या में जनधन में पैसा आने के साथ भीड़ लग रही है, उसको कैसे वहां सोशल डिस्टेंसिंग मेंटेन कराया जाए, इसमें एनसीसी के कैडेट्स आगे बढ़कर के भूमिका निभा रहे हैं।
Human Resources Development Minister Ramesh Pokhriyal Nishank today announced that Joint Entrance Examination JEE Mains to be held from 18th to 23rd of July. Interacting with students from across the country, the minister said the JEE Advanced will be held in August and the dates will be announced soon. Mr. Nishank said National Eligibility Cum Entrance Test NEET will be held on 26th of July. The HRD minister said decision will be taken on pending CBSE class 10th and 12th board exams soon. The two crucial exams were postponed due to the lockdown imposed in the country to combat COVID-19. In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Speaking exclusively to AIR News, Dr. A.K. Vashne, senior physician at the RML Hospital, said that consumption of alcohol negatively affects people.
जो शराब पीना है ये एक बहुत बड़ा सामाजिक परेशानी का सवाल है। तो देखिए बहुत बहस होती रहती है कि ये क्या करना चाहिए क्या नहीं करना चाहिए, परंतु जो लोग शराब के आदी हो चुके हैं अगर उनको शराब नहीं मिलती तो उनके शरीर में सिम्टम होने लगते हैं और वो शराब पीने के लिए कुछ भी करने को तैयार हो जाते हैं।
In an effort to guard against fake news being circulated on various platforms, we bring you our segment on fact-checking and mythbusters. Dr. A.K. Vashne, senior physician at the RML Hospital, has clarified that eating non-vegetarian food does not make a person vulnerable to COVID-19.
खाने की कोई भी चीज, चाहे वो वेजिटेरियन हो या नॉन वेजिटेरियन हो, चाहे मीट हो, मुर्गा हो, मछली हो या अंडा हो, उनसे वायरस नहीं फैलता। ये जरूर है कि जो भी भोजन आप करें वो अच्छी तरीके से पका हुआ होना चाहिए। कोई भी वेजिटेरियन या नॉन वेजिटेरियन फूड से ये वायरस से फैलने की कोई भी रिपोर्ट नहीं आई है।
The Textiles Ministry has assured farmers in Maharashtra that the Cotton Corporation of India, CCI, is fully prepared to purchase cotton at minimum support price in the state during the ongoing lockdown. The MSP operations are continuing and CCI's procurement is currently on at 34 centres in the state. The ministry's move comes amid concerns that traders may not offer a better price in view of the pandemic situation, forcing farmers to avail the MSP rates. Our Mumbai correspondent tells us more.
The Textile Ministry has said the procurement is regulated by states' Agriculture Produce Market Committees, APMCs, and 27 centres are coming under red zones wherein procurement is expected to pick up this week. In the remaining 22 centres, the state government has been approached by the CCI for issue of passes and tokens to farmers to bring cotton, and the matter is being constantly monitored by the Ministry of Textiles through daily status reports on arrival of farmers and procurement at the APMCs. The District Collector of Latur ordered closure of all liquor shops in district till further orders. Meanwhile, in a positive story, Dr. Rajendra Chandorkar from Alibag, a beach town near Mumbai, himself drove an ambulance 1.5 kilometers away and ferried baby to be admitted to the ICU of the hospital, thus saving his life. Sonali Ghadar Patil, AIR News, Mumbai.
In Jammu and Kashmir, people have come forward to help the needy in the wake of COVID-19 outbreak. To know more, let's listen to our Srinagar correspondent.
Amid the pandemic and the unprecedented circumstances in view, volunteers of an NGO by the name Civil Society Kupwara have been on their toes and provide every assistance to the widows, poor, destitute and the needy persons with medicines and the basic necessities. When we spoke to convener of Civil Society Kupwara, Shaukat Masoodi, he said,
फेसबुक एक वाहिद जरिया बन चुका है जिससे हम इमरजेंसी ड्रग्स श्रीनगर, बारामूला और सोपोर से अरेंज करके फ्री ऑफ कॉस्ट उनको मुहैया कराते हैं जो इन मेडिसिन की तलाश में रहते हैं। जब भी हमें पता चलता है कि कहीं पे हमारे पेशेंट्स खून के लिए तरस रहे हैं, हमारे वॉलंटियर्स उन अस्पतालों पे पहुंच जाते हैं और ब्लड डोनेट करके उनकी जिंदगियां बचाते हैं।
विद रफीक अहमद फ्रॉम कुपवारा, दिस इज सुनील कोल फॉर AIR न्यूज फ्रॉम श्रीनगर।
Prime Minister Narendra Modi today had a phone call with Prime Minister of Portugal, Antonio Costa. The two leaders discussed the state of COVID-19 pandemic and the steps being taken by both countries to control its health and economic impact. The Prime Minister commended Mr. Costa for his effective handling of the crisis. Actor Gulshan Grover urged everyone to follow government directions during the lockdown.
सभी को मैं रिक्वेस्ट करता हूं, आपकी गवर्नमेंट, आपकी अथॉरिटीज सब कुछ आपकी भलाई के लिए कर रही है। फॉलो ऑल द रूल्स, स्टे एट होम।
The mortal remains of Colonel Ashutosh Sharma, who got martyred in Kashmir in an encounter, were consigned to flames with full military honours in Jaipur today. Colonel Sharma, commanding officer of 21 Rashtriya Rifles, was among those 5 security personnel who were martyred during an encounter with terrorists at Kupwara in North Kashmir. In Chandigarh, the mortal remains of Major Anuj Sood, who sacrificed his life for the country at Kupwara, were also consigned to flames today at Mani Majra cremation ground with full military honours. The News Services Division of All India Radio, in its bilingual live phone-in program today, will bring you a special discussion on COVID-19. Dr. Aparna Agrawal, Professor Medicine, Lady Hardinge Medical College, will participate in the discussion. Listeners can ask questions to the expert on our toll-free telephone number 1800115767. One can also ask questions on the telephone number 011-2331-4444 and post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:25 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for regular updates. Civil Aviation Ministry and DGCA have launched the Garud Government Authorization for Relief Using Drones portal for providing fast-track conditional exemptions to government agencies for COVID-19 related drone operations. The step has been taken to aid government entities in addressing the challenges posed by COVID-19 and will remain in force until further orders. In a tweet, the Civil Aviation Ministry said any violation of provisions will make the conditional exemption null and void and will lead to penal action. And now, before we end, the headlines once again. Group of Ministers reviews COVID-19 situation. Health Minister says use of technology is integral for containment strategy. Home Ministry issues guidelines for movement of Indians stranded outside as well as those stuck in India. India to operate 64 special flights to repatriate over 14,800 stranded Indians from 12 countries. All existing visas suspended till prohibition on international air travel. Government procures pulses and oilseeds worth 2,682 crore rupees, benefiting more than 3,25,000 farmers. And JEE mains to be held from 18th to 23rd of July and NEET examination on 26th of July. And with that, we end the special news program on COVID-19.